There is a myth that ankylosing spondylitis only occurs in Caucasian males, but this is not true. Ankylosing spondylitis can occur in the Black population, and it's important that Black Americans do recognize the signs and symptoms of ankylosing spondylitis because the disease can be more severe in this population. Ankylosing spondylitis can cause inflammation in the spine and the joints, and this can cause back pain, stiffness, reduced flexibility, and decreased range of motion. Being aggressive with your treatment for AS is extremely important because prolonged inflammation can lead to the bones in your spine fusing or locking together. It can cause spinal fractures and also lead to permanent disability in the spine. When Black Americans get diagnosed with AS, it may be more severe and there may be more complications, such as hypertension, heart disease, and eye inflammation. That is why it's extremely important to recognize the signs and symptoms and get on aggressive treatment as soon as possible. There's also a higher disease burden or high disease activity when Black Americans are diagnosed. It may be difficult for Black Americans to get a diagnosis of AS for many reasons. White males often carry a gene, HLA-B27, which is checked often by their physicians. This occurs in the Caucasian population more often. Because of this reason, Black Americans may not be tested and therefore not diagnosed in a timely fashion. It is important to know about the gene HLA-B27 because there is an increased risk of developing AS with this gene. But it's also important that you speak to your doctor about symptoms if this gene is not present. Knowing the gene and the symptoms may lead to an earlier diagnosis. Here are some tips for Black Americans in their treatment for AS. It's extremely important to have a good relationship with your doctor who can oversee your regimen. It is important to find someone who may look like you. Depending on where you are living, you may not have a Black rheumatologist nearby. If that is the case, you may look for other telemedicine or virtual options. When treating your AS, feel empowered. You are your own best advocate. Bring notes to your visit. Have an open dialogue with your physician. You may also bring someone else who may be listening in on the conversation, so you may not feel as overwhelmed. There are many treatment options out there. And also, if you're not comfortable with what one physician says, it is important to seek a second or third opinion. If you don't feel that your treatment option is working for your ankylosing spondylitis, it's important to communicate with your physician. Your physician may then discuss other treatment options which are available for you.